I think that vision screenings are very, very important. My thought on school screening is it's essential. I felt like had I not been, well, actually, for myself as a child, the school screening missed my vision problem. I do wear glasses and I'm nearsighted, and my vision problem wasn't found until I was in junior high.
Wow.
And so consequently, I was my eyesight was getting worse. I had difficulty copying off the board, and had it not been for the teacher to identify me as being perhaps not paying attention in class, that when I was sent to the nurse, they found that I had nearsightedness. I think that vision screenings are very, very important. In the school district that I work that is local here, I work with the school nurse, the district nurse, in trying to come up with a more effective but efficient way of screening the vision of the kids, because oftentimes in school screenings, the student is tested only at 20 feet. So it's mostly distance acuity that they're measuring. We've implemented both distance and near screening because most of the children do their learning on the desk. They're reading, they're writing. Yes, they do have to copy off the board, but most of the time they're studying or they're reviewing their books and the material, written material. So both those distances have to be evaluated to help the child effectively learn.
You had mentioned to me one time that you also sometimes you encourage or you like the idea of bringing in right eye into a screening. So could you talk about what
Yes.
that would do for maybe kind of? I know the AOA says that a school vision screening only covers 4% of a comprehensive eye exam, and misses 75% of vision problems. So like maybe where could you see a screening going to? Meaning, could it cover a lot of maybe eye tracking and more elements of vision?
Yeah, well, the right eye is a wonderful device, a computerized device that measures eye movement skills, saccades, pursuits. It could be as perhaps as comprehensive as you want it to be, but for screening purpose, you want to try to do it in a very timely manner because you're going to be checking multiple students during the day. Other screenings that as I mentioned, could be done through the nurses as well as the healthcare volunteers that the school solicits. What I've done with a lot of the private schools is set up a more comprehensive visual perceptual type screening where patients were not only, not patients, but students were not only asked to view a letter chart. We looked at their eye movement skills, but we also were having them listen to certain or do a certain type of screening that identifies whether or not they're having any kind of auditory visual deficits. I also included a task where they were able to copy forms. So you want to see how their pencil grasp is and whether or not they can visualize what the target is and be able to transfer that image onto a piece of paper. Those type of screenings take quite a bit longer, and that's where I enlist the help of a number of parents so they can see that for themselves how comprehensive the visual process is. And when they see their child and their performance, they get better understand what's going on and why they're having difficulty with certain things like spelling perhaps, or when they are trying to engage in certain type of activities physically that they can't initiate. And much of that involves a visual process. So visual process really is, I would say a vast majority of everything we do. So it's more than 80%.